Hi everyone, welcome back to my channel. I'm Hiba and I'm a fourth year medical student studying at the University of Manchester. Since I started creating videos, I get asked quite a lot about my experience at Manchester and whether I would recommend applying to study medicine here. Being in the fourth year of the course, I feel like I'm definitely in the position where I can talk you through a few pros and cons if you're considering applying here, and that's exactly what I'm going to be doing in this video. I'm going to start off talking about the pros of applying to Manchester and the course at Manchester and the university itself, and then I'm also going to move on to talking about a few cons. This is going to be a longer video, but it's going to be really in-depth, so if you are seriously considering applying to Manchester, then I do recommend watching it all the way up to the end. I 100% guarantee you will learn something new that you didn't know before after watching this video. By the end of the video, I'm sure you're going to have a much better idea of what you're going to be going into if you apply to medicine at Manchester. Before we begin though, can I please ask you to subscribe to my channel and also like this video because it really helps me out. So first we're going to begin with the positives, and there are actually a lot of them. 14 on this list to be precise. Pro number 1 is PBL. The fact that Manchester teaches medicine through problem-based learning is a pro in my eyes. Firstly, because the study is in small groups of 8 to 12 students, which is a much smaller group than having all of the 400 students on 1 year of the course sitting in a lecture theatre together. The sessions are supervised by tutors who have a checklist of exactly what you're meant to be going through that week and who are there to guide you to make sure you're on the right track with your learning. Because the groups are much smaller, I personally felt a lot more comfortable asking questions and raising any concerns in PBL than I did if I was in a lecture theatre. You are still going to have some lectures in the week, but I don't think a 100% lecture-based course would have allowed me to engage as much as I've been able to engage with my learning due to being on a PBL course. Also, PBL is the closest you can actually get to experiencing how you're actually going to be learning as a doctor when you get into your working lives. As a doctor, you're not going to be learning by sitting in a lecture theatre and having someone talk at you. You're going to be learning by coming across patients, looking at certain cases, identifying what you do or do not know about that condition. You're going to go and research about the case and about the condition, about the disease, about the treatment and the management of this patient. So I think it's a huge pro that at Manchester we're already put into the habit of learning this way. Pro number 2 is that Manchester is the second biggest city in the UK, and bearing in mind the UK is made up of 4 different countries. So imagine just how multicultural Manchester is as a city. In Manchester you will literally be able to see every single disease that you've read about in your textbook. Because it's such a multicultural city, you'll see a multitude of patients from so many different backgrounds and different disease presentations. You'll also get to see the influence on patients of their social and financial backgrounds, their religious backgrounds, their cultural beliefs. Your experience is just going to be so much more enhanced, and you're definitely going to be at an advantage over students that went to a small university in a smaller, remote type city where most of the population is just Caucasian, for example. Slightly carrying on from that is point number 3, which is because Manchester is such a huge city, for your placements you're going to be sent to a huge variety of GP practices and hospitals. For example, I've done GP placements in the city centre of Manchester, which is like the busiest part of the city, and then I've also been sent to kind of the countryside outskirts areas of Manchester. And at Manchester University they're really keen on helping you to see the difference in healthcare provision between these two areas, the different inpatient populations as well, and it just really broadens your experience. So moving on to pro number 4, I've mentioned that the university really likes you to travel up and down the city so that you can get the best experience possible. The next pro, I'm not sure if it's unique to Manchester at all, but Manchester does give you a travel bursary to allow you to travel to all of these different places that it expects you to go, depending on how far it is from the university's campus. In your clinical years, they also offer you to take free accommodation near these placements if that's more suitable for you. So like I mentioned, it's probably not something that's unique to Manchester, but it's definitely still a pro. In the first couple of years, because you're not traveling that much and you're usually not going that far and usually going as a group, the university will actually book a minibus to take you all there. But when you get into your clinical years, the university will pay you both a chunk of money at the start of the year. It's around £150 to £200 to contribute towards your travel expenses, and then they'll also give you a daily payment for every day that you attend. The 5th pro at Manchester is being able to actually dissect cadavers in anatomy. Now of course you don't have to do this if you don't want to, but I just wanted to point out that Manchester is one of the few universities that still allows their students to dissect. It's a form of learning that is not for everyone, but it does add that extra layer of depth to your learning, especially for people who are thinking of going into surgery. Pro number 6 is a huge one for me, and that is that Manchester is really supportive of you learning a language alongside your medical studies. They're the only university that has this program called the European Studies program, and what this does is it allows you to learn a language, either German, Spanish or French, alongside your medical studies. They also teach you medical terminology in this language and just general medical knowledge in this language that you would need to kind of practice in these countries. And then in your 5th year, you spent a placement working in a hospital in that country, which is just so cool. It's so unique and it's such a fantastic way of broadening your experience and kind of giving you the opportunity to have that door open for you for if you ever want to go and practice in that country in the future. This was a huge pro for me when I was applying to Manchester. I really wanted to do German European studies alongside my normal medicine course, but unfortunately I didn't actually end up making it to the interview, so I didn't end up getting to do it. You do need to have some prior knowledge of that language, so if you did it at A level or if you did it at GCSE and did really well, so you got an A or A star, or if you just have knowledge of that language through your family or friends or personal reasons. But don't worry if you don't have this pre-existing knowledge, because if you feel like you want to learn a language alongside your medicine course, separately from medicine, so not doing the European Studies program, at Manchester you can enroll onto a huge number of different language courses that they offer, which are part-time, and they are also at a reduced price for students who are already students at the University of Manchester. For these courses, they have a wider range of languages available, so things like Mandarin and Arabic as well. And they also offer the courses at 7 to 8 different levels of difficulty. So if you're a complete beginner, or if you have some knowledge of the language but not enough for you to go on to the European Studies program, then this is a really good opportunity for you to still be able to learn a language. You can enroll onto a course of your chosen language at the level that you're already at, and everyone in your class will be at the same level, and then you can keep going up from there. Also, these courses are year-long courses, so unlike the European Studies program, they're not a 5-year commitment. So the 7th pro is something that you may already know, but in 3rd year at the University of Manchester, the university will give all its students free iPads, which are yours to keep forever. And the reason that they give you them is to help you on the wards, because you have certain tasks that you need to get signed off on your iPads, so this is why they give you them. So yeah, that's definitely a pro. It's a free iPad that's brand new and you get to keep it when you leave the course. So the 8th pro is that at Manchester, because of the way the course is structured, you're going to have quite a few opportunities for you to get some of your work published, even as a medical student. Because the course has some mandatory research blocks that are integrated into it, these are called the PEP and the APEP, you can choose to use that chunk of the year to focus on a research topic of your choice. And if you do well and you manage to do some valuable research, then you can actually get your research published in a scientific paper. This is a great experience. I'm currently in the process of getting some of my research published, and it also looks really, really good for any job applications that you're going to make in the future. The 9th pro is that Manchester really caters for people who have any sort of mitigating circumstances. I'm sure most other universities do this as well, but at Manchester, if you live at home, or if you are a carer for anyone, or if you have any disability of any sort, you get to choose which hospital you want to be based at for your training in your clinical years. So that is from years 3 to 5. All the other students will kind of be randomly allocated, but if you have any sort of mitigating circumstances, Manchester really helps you out and makes sure that you're being supported the best you can. The 10th pro is that at Manchester, around exam time, there is a lot of help available. There are loads and loads of online resources that the university makes available to you, which if you were to access yourself, you'd have to pay for them. And also the university hosts mock OSCEs, which are mock clinical exams to help you revise as well. For anatomy in your preclinical years, so in years 1 to 2, these anatomy resource rooms are open Monday to Friday all day for you to be able to go and revise and practice the questions and look at different pro sections. There are just lots of different sessions that the university puts up specifically for medical students around exam time to help them revise, and for you to have somewhere to go and ask questions if that's what you need, or if you need any extra support as well. Pro number 11 is that Manchester has one of the largest lists of intercalation courses that they offer to medical students at Manchester. Unlike many other universities, a lot of these courses are actually offered at master's level rather than bachelor's, which means if you intercalate at Manchester, you can do a science master's degree in 1 year, whereas some science degrees at master's level can take you up to 3 years to complete. So moving on to just some general pros about Manchester as a university, as a campus, just in general. Pro number 12 is that all students at Manchester who have a low household income get a bursary of £2,000 a year. I can't remember exactly what the threshold is, but a lot of people do qualify for it. You can look up on their website what the actual threshold is for it. But it's a huge help, and it's a huge pro that Manchester gives this to their students to help them financially. Pro number 13 is that there are literally hundreds of societies that you can join at Manchester. Whether you enjoy baking or sports or knitting, or you want to be part of a society that's to do with your religion or your ethnic background or the specialty of medicine that you're interested in, there will literally be a society that exists for you. Because there's so many societies and so much support for students, you'll never ever feel alone in your hobbies or in your interests. Now for the last pro that I'm going to be talking about in this video, pro number 14, and that is that the campus at Manchester is excellent. It's really well located. It's on Oxford Road, which is a road that leads from the city centre all the way to the accommodation. All essentials are close by to the campus, and everything that you'd ever need is never more than walking distance away. The bus route on this road, so the Oxford Road, Grimslow Road bus route, is actually said to be the busiest bus route in Europe. And like I mentioned, this is the road that takes you from the accommodation to the university to the city centre. So transport on campus is never a problem. Also, the libraries are amazing. I never expected there to be so many libraries at Manchester. They're literally dotted everywhere. You're not going to ever be too far from one. They're really well equipped. They have computers for you to use. They have rooms that you can book for private study. They even give you out earplugs for you to use when you're revising, which I am very guilty of asking repeatedly for. But yeah, in general, the campus is amazing. There's nothing that you would need that isn't there. So now I'm going to move on to talking about some of the cons that I feel exist at Manchester. Con number 1 is that at Manchester in the first 2 years there are actually no mock paper exams for the exams that you do at the end of each semester. So although there are mock exams for the clinical exams, which are when they're testing your skills, and also there are mock exams for the papers that you will get in your clinical years, so in years 3 to 5. There aren't any exam questions in years 1 to 2 for you to practice and revise for your end of semester exams. They do give you a mid-semester test at the middle of the semester, but that only has 15 questions, and it's nowhere near enough for you to actually revise and practice studying for your 125 question long paper, which you're going to get at the end of the semester. I personally just found it difficult going through my revision again and again without actually having questions to practice my knowledge on and see if I'm actually retaining the knowledge or not. Because the exams are internal, they're specific to your medical school, and so online you're never going to find the same style of questions that the medical school is going to be giving you at the end of each semester. Even if you do find questions from other universities that they use, each medical school examines you in a completely different way, so it's just not going to be helpful. So I think definitely this is a con. There should be some sort of practice papers available for you to do in your first 2 years of medicine. Con number 2 is that because Manchester is the largest medical school in the UK, that does have its advantages, but it means that you actually never get to know everyone on the course. I think it would be a lot nicer if at least everyone in your year knew each other. Just doing things together or getting help or discussing anything would just be made easier. But I'm now in my 4th year, and every placement I still see students who are in my year but I've never even seen or even heard of before. And I know it's always nice to get to know new people, but sometimes it's just like, whoa, we've been on the same course for like 4 years and we don't know each other. Unless you join like societies or do extracurriculars and things together, sometimes the medical school just feels a bit too big, and to me it doesn't really feel like a close-knit community. The third con is that the course is very, very independent, and I think this is the biggest con for me because I really feel this on a regular basis. So yes, I talked about doing independent work in PBL as a pro earlier in this video, and I do still stand by that. I think in the first 2 years when you're doing PBL, because you still have supervision and guidance, I think it's just a right balance of doing things independently but also being guided at the same time. Whereas in clinical years it gets even more independent, maybe a bit too independent. So you'll only be taught a skill once, and in terms of teaching, that's literally it. Like now you have the responsibility to go and practice that on real patients. No one's going to be following up asking if you've done it or trying to help you find opportunities to do it, or showing you again and again and giving you multiple teaching sessions on how to master the skill. You just learn it once and then that's it, and now you have to go and do it on real patients. Basically, you'll get as little or as much done as you individually try to. There's no kind of external motivation or external encouragement for you to get things done and practice certain skills. It is compulsory to get certain skills signed off once, so at that point you will have a doctor watch you do the skill and kind of give you some feedback as well maybe, but you are responsible for finding that doctor to watch you yourself. And then once you get it signed off, no one's actually going to be checking if you've been practicing that skill again. So you can be really keen and do it about 50 times over the year and become a pro, or you could really be struggling with doing that skill and struggling on how to find a patient to do it or how to actually do it when you approach a patient. But after you've got it signed off that minimum amount of times, the medical school doesn't really concern itself with checking up on your teaching again. I guess this probably happens in other medical schools too, but it is something that strikes out to me as a big con, and it's something that I think there could be ways to improve. Con number 4 is slightly on the same topic but slightly different too, and that is that the teaching is really inconsistent depending on which hospital you get placed at and which doctor you get placed with. Again, this is probably not unique to Manchester. It probably happens at other medical schools too, but it's still a big con. So my friend and I could be studying the same topic, so say for example the heart, and we'd be placed at different hospitals and we'd have different doctors teaching us that topic, and by the end of it, one of us may have a lot more knowledge on that topic than the other. For example, I may have seen some really fascinating heart procedures, and I may have been taught really in depth about certain heart diseases, whereas my friend may come out of the same placement on the same block not knowing that information. My friend may be completely unaware about the things that I've seen and learnt, and may have obtained a lot of knowledge on something else that I may not have seen or learned about. So the teaching, I felt, can be really inconsistent, and even though these two students both go to the University of Manchester, no two students will actually have the same teaching experience. For some students, it's great because they get placed with a doctor who's really into teaching and gives them a lot of time whilst they're doing their daily activities. But other students may be at a disadvantage because they may get placed with a doctor who's not really that into teaching, and they just really find it an inconvenience having a student with them on that day. To be honest, it kind of is just the nature of medicine, and in a way it is inevitable because there's 400 students in like 1 year for medicine, and you can't put 400 students in the same hospital and get the same doctor to teach them. But I do think that there could be some things done to standardize the teaching a little bit more, so there's less variation on how much students know based on what they've been taught by the university. Finally, talking about con number 5, as I mentioned earlier, most of the students will be allocated randomly to different hospitals where you're going to be based for years 3, 4 and 5 of the course, so for 3 years of the course. Con number 5 is that a quarter of the students will actually get put into a hospital in Preston, which is not in Manchester. It's actually a city outside of Manchester that kind of neighbours Manchester. I shouldn't really be calling this a con because from what I know, the teaching at Preston is much better because the groups are much smaller and the hospital is much smaller, so you have more focus on you and there's a lot of focus on the teaching over there. But I've put this in the con section of this video because most of you will be deciding whether or not to apply to Manchester based on the fact that you're going to be living in Manchester for 5 years. So most of you will be applying here thinking that you're going to be in Manchester for 5 years and because you want to be in this city, but there's a chance that you may be put in the group of students that have to move to a different city, which is not that far from Manchester, but still a different city, for 3 years of the course, so the majority of the course. So that can be annoying if you wanted to come to Manchester and you end up being moved to Preston. The transport links to and from Preston are good, and it's just a simple train journey getting back and forth, so you can still come and visit as often as you want really, come on the weekends to meet your friends or do any extracurricular activities, but in most cases you will have to move there because it's not an easy daily commute. That's it for this video, guys. That was a list of pros and cons that I've put together that I think you should know about if you're considering applying to Manchester. For me, the pros do really outweigh the cons, and some of the cons are things that you are likely to find at other universities as well. Manchester is a really great university. Obviously, every university will come with its pros and cons, and these will affect people in different ways, and they may or may not be significant to you depending on your preferences. But yeah, I hope it was helpful and that it's given you a better insight into the university and helped you make your decision. If it has, then please like this video and also subscribe to my channel. It really helps me out, and it also encourages me to keep making videos like this one. Let me know in the comments what new information you learned from this video or what you already knew about the university. Thank you so much for watching, and I'll see you in the next video.